Every few minutes, someone in Canada is diagnosed with type 2 diabetes. There are 11 million people in Canada living with type 2 diabetes or pre-diabetes. But if you're one of those people who has recently been told that you're type 2 diabetic or pre-diabetic, is it possible to reverse this? The good news is that it is. I'm Dr. Rawat, an Indian origin, England-trained, Canada-based family physician who additionally studied nutrition at Harvard and founded healthgroupcoaching.com, where for the last few years I've been running a metabolic disease reversal program, which consists of 8 Zoom group video sessions and app-based tracking, including direct messages. If interested, visit me on healthgroupcoaching.com. In this video, I'll be detailing the top 5 impactful steps that you can take to put diabetes into remission. Number 1 is to reduce visceral fat. This is the dangerous metabolically active fat around the belly within the organs like the liver and the pancreas. This is what leads to insulin resistance, fatty liver, polycystic ovaries, chronic inflammation as well. Excess belly fat is primarily due to excess calories. This is storage of energy. When you consume calories in the form of food, there are many things your body can do with this. This is called energy partitioning. It can burn it as fuel, use it to build structures, or store it. When you're active, for example, if you go for a walk after a meal, you'll burn those calories. If you've done exercise and your body needs to build muscle, you'll use those calories and other nutrients like protein to build your structures. When your body needs to store energy, it can also store it as glycogen, which is within your muscles. But those people who have larger muscles will have more stores of glycogen. Your body can also store fat under the skin, called subcutaneous fat. However, this is out of your control. It is determined by genetic, epigenetic, and environmental factors. If historically your ancestors lived in tropical countries, they would have needed less fat under the skin for insulation. If they lived in areas where there was lots of agriculture, they would have naturally had a lower protein, higher carbohydrate diet. If they had to go through colonization, wars, famines, droughts, floods, then there would be certain epigenetic changes which have taken place, which promote fat storage as a survival benefit. Akin to a camel having a hump on its back, these people are predisposed to having that hump around the belly, which is great if you're encountering a famine, but damaging when we are surrounded by Uber Eats, drive-thrus, and fast food. So when you consume excess calories to what you require over time, and you don't burn those because of activity, you haven't got the muscle stores for glycogen because your muscles are not large, and you're not genetically gifted and able to store large amounts of fat under the skin, then the excess fat which stores around the belly, in the liver and organs, is what leads to metabolic disease. And getting into a calorific deficit is what will start reversing this. There are 5 further ways of getting into a calorific deficit, whether this is eating cleaner, a whole food diet, eating in a more restricted time window, intermittent fasting, increasing your step counts and calorie burn during the day, formally tracking your calories, or working on hormonal factors like adequate sleep, stress management, gut microbiome. This is the topic for a next video, so make sure you subscribe. Step number 2 is to increase muscle mass. As I explained earlier, the more muscle you have, the more calories you'll burn at rest. There is data to show that those people will be more active generally, and you'll have larger glycogen stores to put away that excess energy safely. You won't have to rely on storing that energy around your belly in your organs where it is not safe to do so. Step number 3 is to optimize your gut microbiome. The trillions of bacteria which live in our gut have a profound effect on our metabolism. This also is a topic for another video, but primarily you need to increase your fiber intake, aiming for 25 to 40 grams per day, increase consumption of whole foods, increase consumption of fermented probiotic foods, consider certain evidence-based probiotics, and reduce intake of ultra-processed refined foods, saturated fats, and high-temperature burned and deep-fried foods which contain advanced glycation and advanced lipoxidation end products. Step number 4 is to improve your insulin sensitivity. The hallmark of metabolic disease is insulin resistance, which means that your body no longer wants to listen to insulin. The job of insulin is to push energy or sugar into cells, into muscle cells as glycogen, into liver cells as triglycerides, and also to stop the burning of fat. Because insulin is mediated by nutrient sensors which tell the body that there is excess energy. And so when you have excess energy, you do not need to burn fat. You only need to burn fat when you do not have energy. The reason that insulin resistance develops is because there is already too much energy within the cells, and this energy is causing damage. Fatty liver happens when there is more than 5% fat within cells, which is abnormal. This can then start damaging the liver cells. One hallmark of stage 2 fatty liver is a rise in liver enzymes like AST, ALT, gamma GT, along with a rise in inflammatory markers like CRP. This shows us that liver cells are being damaged. Enzymes which should normally be within the liver cells are leaking into the bloodstream and being detected on that blood test because the membranes of those liver cells have been damaged by fat. And that fat is excess energy stores. And so while the job of insulin is to push energy into cells from the bloodstream, the liver and other organs start resisting this because what they're saying is there's already too much energy in here and it's causing damage. It's a bit like a bouncer at a club trying to stop people from coming in, saying that there are already too many people inside and they're already causing a riot. That's basically insulin resistance. And the most evidence-based strategy to reverse insulin resistance, in addition to the other strategies that I've already discussed on this video, is to do intermittent fasting to stop the flow of energy. As insulin levels come down, there is evidence that even in calorie matched and weight matched studies, insulin sensitivity improves in those clients. My preferred technique of intermittent fasting is to do it with your circadian hormones. Focus on consuming calories earlier in the day and not later in the day. And this is also optimal for energy partitioning, giving your body the right signals as to when it should be burning calories as fuel, using it to build structures, or simply storing it as fat. And there is evidence of the benefit of this even in calorie matched and weight matched control trials. Strategy number 5 is to consider certain supplements. I have an entire blog on this topic, but we know that fiber, for example, can reduce sugar and cholesterol. Omega-3 can remove fat deposition from the liver, which will in turn reduce insulin resistance. And there are certain probiotics which have also shown promise for weight loss and reversing insulin resistance. For those who are more keen on medication-like supplements, they can consider berberine. Before you go down that route, however, I would strongly urge you do everything else that has been discussed on this video. These are examples of studies in which a low-calorie diet or a fasting mimicking diet was used to reverse diabetes. The InterFast 2 study, this study here, this study done in China, this study in which 5-2 intermittent fasting was compared to metformin and Jardiance for diabetes, and the fasting mimicking diet came on top for weight loss as well as better sugar control. The landmark direct studies done by Professor Roy Taylor at Newcastle University, who demonstrated how removal of visceral or truncal belly fat within the organs would reverse diabetes, and he also wrote the book Life Without Diabetes. He did the Banting Memorial Lecture on the twin cycle hypothesis of insulin resistance development, and his work has also led to the NHS Type 2 Diabetes Reversal Remission Program, which is essentially a low-calorie diet. If you click on the link in bio, you'll be able to come to my website, healthgroupcoaching.com, click on supplements and blogs, and scroll down to the blog titled Top Supplements to Reverse Prediabetes. You'll find a previous video I've done on the topic, a longer one, as well as Amazon links for certain supplements which you could consider if you would like coaching with me. For many years now, I have been running a metabolic disease reversal program. It's a 4-week program which is designed to reverse metabolic conditions. Hundreds of people have already gone through the program. You're welcome to check all of their testimonials. This is Andrea, for instance, who reversed her metabolic conditions and was with me in 2023. I hope you found the video useful. Make sure you share this with any friends and family who will benefit from this information. If you would like to subscribe to my metabolic disease reversal program, then visit me on healthgroupcoaching.com. If you'd like to watch more videos, then make sure you subscribe to the YouTube channel. Feel free to put a comment in the comment section, and I'll reply to all my comments individually, and I'll see you at the next video.